Welcome everybody to our September Capital Chat. I'm Brooke Lovelace, the Executive Director of the Iowa Developmental Disabilities Council. We've got a great presentation for you today. We have a guest speaker that's going to talk a little bit about how she was successful with changing policy, which is not always easy to do, as we know. And then we're going to talk a little bit about the results that we got from our conference, a legislative game that we played there for those that didn't make it. We're going to talk a little bit about the election that's coming up, and then talk about a little bit of the stuff that's happening in October and the rest of the year here. So a little bit of housekeeping, and I'm going to turn it over so we can get started here. There should be an interpreter that's pinned for you, and there's also closed captioning. If you hit the three little buttons that say more, you should be able to bring up the closed captioning. This is recorded. We will put this recording on the website along with our slides. That usually takes about a day or so. And with that, I'm going to turn it over to Carlin to introduce our speaker. Thanks everybody for being here.
Thanks, Brooke. I'm Carlin Crow. I'm the Public Policy Manager with the Iowa Developmental Disabilities Council. And welcome. So glad to have you all here today. And I have the honor of introducing our guest speaker. And also wanted to introduce Amy Campbell, who's running the slides today, and she'll fill in everything I forgot to say later in this in our presentation. But also, if the slides get messed up, yell at Amy. Actually, having her run the slides is good because it usually means we need to speed up or slow down. So thanks for doing that, Amy. And thanks to Shanna Seek for joining us today. Shanna is the founder of Mason's Lighthouse, and she's going to tell us all about what that means. But we just wanted to let you know the reason why we asked her to join us today. She was almost single-handedly the reason that House File 933 passed this past legislative session. She is a powerhouse mom who decided something needed to be done because of her own family's experience and went to work and got it done very quickly. So we thought she was a great example, and after talking to her and asking her how she got it done, she was very humble in explaining all that she had to do and what it took. We thought that she'd be a great speaker for advocates who may be interested in introducing a bill, or you have an idea that you want to share with your legislator and what it takes to get something passed. And she has some great tips to share with us today. And just as a little overview before you get started, she's going to, as I said, tell us about this. But because of her work, Iowa now has a license, when the first state to do it, for pediatric palliative care centers. And the bill, House File 933, helps set this up. And Iowa, when Shanna is able to complete the rest of her goals and her work, will be one of just a few states to have a center like Mason's Lighthouse. So I'm going to turn it over to her and let her tell us all about her great work, and just wanted to thank her again for joining us today.
Thank you, Carlin, for having me. So Mason's Lighthouse, we started in honor of our son. We needed a hospice that was more than just at our home, but not only did we not want inpatient, but we were not able to go inpatient just because of his care team being in Minnesota. Iowa or blank wouldn't take him as a patient since he wasn't theirs to begin with. So we had searched and we had found one. Our doctors had found one in Minneapolis. And so that's kind of how we came to this. We were fortunate enough to not only take our son there, but our whole family ended up being able to go and stay. So that was very, very nice. In that experience, we we're on our way home, and my husband looked at me and basically just said, "This is the most horrible drive. Iowa needs a place like this." And a few months later, I was finding myself not having much to do and wondering what I was going to do. And so therefore, I said, "How serious are you?" That's when Mason's Lighthouse became a thing. So we've got our, nonprofit 501c3, but what we were running into is the way that Iowa's laws were set up, we didn't really qualify for a skilled nursing facility, and we didn't qualify for the residential facility. And so there are pieces and components from each of those that we needed to work through and to be able to offer and have for the services that we will offer in our home for these children and families. When we first started looking into that, I was thinking this was going to be like a 2 to 3 year project trying to get pushed through legislature. And I reached out to a few representatives. I started with, our local ones. I had just a little bit of feedback, not much. And then all of a sudden I had one of the House representatives, Ann Meyer, reached out to me, and she said, "Can you meet with me?" So when I walked into a meeting with a table full of representatives, I was a little surprised, but definitely it just got rolling from there. So I took a 1-page handout to give them. That is the one thing like that you want to make sure it's short and sweet. It's to the point. It's what I shared was definitely where we're lacking, what our trouble areas were, and what we were going to provide that wasn't provided in Iowa, and the need of why we were wanting to provide these services. I will tell you, I have no background doing any legislative work. I actually walked into the Capitol and was like, I don't even have any idea where I need to go for this meeting. So whole new world, whole new aspect to me. I had no intentions of, when we set this, goal to do that I would be doing any of that. So, so to know that it happened in just a few months is amazing to me. We had that first meeting, and basically before that meeting, I was trying to research all the House and senators that would have anything to do with like medical background. Okay. So you're looking into that because that's what we're, going for. Any medical, any children background, if their spouse had that, if they had it, just kind of doing your back leg research and knowing who would be able to understand the need. Because a lot of people that are voting don't even understand what the need is. And so we're just trying to, figure out the best way to go about that. And that seemed to really work for us with Ann being a nurse. So not only was I explaining things, but she's backing me up on this is needed, and explaining it to her colleagues as well. So when it got ran on the floor, it passed unanimously through the House. The Senate, however, was very, very, very difficult. I couldn't get a response from really anyone. And even the representatives were trying to get a response for me. It took a lot of, who do I know that would know a senator? Who do I know that would have any influence on just getting a conversation? Not only did it take that, but it took just hours of me sitting at the Capitol, filling out the cards of trying to talk to anybody, and hoping that they would come out. Little did that happen. I had one come out, Senator Wormy, and she actually was the one who ended up running our bill. And she was amazing. She was a very good advocate for us. And the things that she portrayed to us about why the Senate, this really wasn't on their radar, is it hasn't been done, right? Like there is no other state that has a pediatric palliative care bill. So that was kind of concerning. The other thing that they wanted proof on is they thought since we were asking to be able to have all the state funding that any other hospice has, or and or medical centers have, they thought that that meant that we were asking for more allocated funds to the state for us. So we definitely did have to prove that not only were we not costing the state, but overall we're going to save the state money. So once we proved that, that made it easier. They still weren't understanding like our concept, because again, it hasn't been done, right? So we basically sent them a video, because they're not going to read a 12-page report basically on why this is needed. So we sent them a video of where we stayed at their Crescent Cove in Minneapolis, and just said, here, this is the tour of their home. It shows really, you know, why they do what they do. It's a 3-minute video. Would you please just take time to watch this? We had so much feedback on that video that that's really what I think pushed us through, is because they saw what they did. And so knowing that we're actually filling a gap, that Iowa doesn't offer this. There are lots of different things offered, but we fill the gap that Iowa needs to fill for children and families. And so being able to prove all of these things, it ended up passing unanimously through the Senate as well. I think one of our biggest tips would be really, I think, just trying to have those conversations consistently, checking back in, emailing and saying, thank you for having the conversation. What else can I do? You know, I can be there. I can, you know, meet you. I can do whatever needs to be done. I can explain to whoever, but just being available, I guess, is what really, it took a lot of time, and being available to have any of those meetings whenever they're available. So if that means waiting from 9 a.m. when they think they're going to be able to meet with you, and it's pushed out till 3, you're still there, and then you're available for that meeting. And it does, I mean, we ended up having several different meetings with many legislators around the table, and talking everything out as to why do we need this? Why do we do this? Can we change this? Can we change that? And it's a lot of give and take, but at the same time, if we accomplish our full goal, then yes, like that's the ultimate mission. So we were able to get that done. I know this upcoming session, there's a couple things that we're going to tweak in there, just because with the residential license, it says that we have to have 3 patients at all times. So we're going to go back and change that, so we don't have to do that. I mean, there's going to be a Wednesday in the middle of the school year where we don't have 3 respite kids or 3 hospice kids at one time. There's also, you know, and knowing your background too, as to there's 3 other homes like this in the US, and knowing what their legislative work looks like, and how they're able to operate in their state, and being able to use that incorporated into your, I don't know, plan, I guess, is for lack of a better word. But that really helped too, is just knowing what other states are doing. And also Minnesota's legislation has a residential hospice section in it, and that's what they run under. And so it was one of those that this is all what Minnesota says, even though it's not under a pediatric palliative care home. And so they were set up a little bit differently. Instead of having like our palliative patient definition, is their pediatric hospice definition. And so there are things that, you know, just, it might be worded just slightly differently or in a different area, but it's still the same. And so being able to use that too, to support that these other homes have been up and running and this is what's working, helped as well. I think that's, Carlin, am I covering everything?
I was reading the tips that we had talked about earlier, and you definitely hit them all. And I'll tell our audience too that we'll be willing to share these and in case they weren't taking notes. That's great tips. Anything else that one thing that you said was that it really took a lot of time, and being available was so important. Just for regular Iowans who, like you, who never thought you would be in this position again, or be in this position to do what you did. What other tips would you have to just, encourage people if you have something that you want to change? How can you move forward and do it?
I would say really just go for it. I really was very nervous even having that first meeting, and I walked out of that first meeting and was blown away and just like, wow, that was actually super easy. I'm not sure why I was so nervous about this. So I would say just bring it up, just go for it. And I mean, it sounds bad, but like they're just humans, and they're just trying to do what's best. So if you're bringing ideas to the table that, we don't have or that we need to change, like they're going to listen to you. And then another thing is kind of try and look and see what else is running for bills. I think too is important, because we also ended up covering one of the bills that another mom was trying to cover. And so they kind of threw hers out knowing that we would cover that too. And that mom was okay with it. Like I met with her and explained everything. So, just kind of figuring out too what else is running and just going for it really. I mean, just takes a phone call, just a conversation, and you can get it done really.
There's one more thing I want to ask you, and then we'll ask the audience if they have some questions. One thing you said, because you kind of made it sound really easy today, and I know it wasn't, but you did say you have to play the politics of politics. You want to tell us what you meant by that, or what kind of tips you have around that?
Yeah. So you very much like you have to put your own, I think, political beliefs aside and be willing to work with obviously both parties, and just show that it's for all people and not just one party or another. And I think that is very, I don't know how to say it, but intriguing to them that, if you can really show that, which I mean, with the people you're working for and with, there's no doubt that it's every, side of the political parties. So I would say push that aside. And then not only that, but we had to play the political game, which was, our governor is stepping down. There's a new governor coming. So we had a governor that's getting ready to throw or just threw his hat in the race this summer, and part of that was we weren't sure we were going to get in this session because of that. Eddie Andrews ran for governor, or is running for governor, and he also ran our bill in the House, and there was other House leaders that were thinking about running for governor as well. And so it was just kind of a battle of, are we going to get in, because this timing like really needs to not be right now, basically, but just being patient and letting them also run the politics of politics, because they know that game and they know what they've got to do to get things across the line. And so just being patient and working through that as well.
Really great tips. Thank you so much. Does anybody online or have a question, or you can put it in the chat too, if that's easier.
Dakota's got one. Dakota, you're on mute, so go ahead.
How did you justify to the state that it actually saved them money rather than spending more money than what was needed?
Yeah, so hospice dollars are already allocated. and respite dollars are already allocated. And so just because we would be a different location, basically, we're not saying that there's more kids that are needing it. We're just saying that it's already allocated for those kids. And so it's just a matter of, moving that funding from one location to another or whatever. But on top of that, we also showed that by providing this service, we will also, like with our grief support system and everything through Mason's Lighthouse, we will also help these families navigate through their whole journey. And so when we're doing that, we're also helping cut down, some of the mental health costs on the state, as we're helping them walk through that journey and making it as smooth as possible for these families, instead of them not having options and going through worse conditions maybe, and then having a harder time coping with everything.
While other people are thinking, Shanna, you had great press coverage. So I was wondering, and if anybody wants to know, just Google her name or Mason's Lighthouse, and you will find a bunch of different, throughout the process, there was a lot of coverage of it. Did you reach out to them, or
so what we did, Amy, is basically we have a big group that is homes that do exist and homes that are trying to exist throughout the US. And we have a big group, and we have support now that some of these, it's like we call it the Lighthouse Coalition, but we've come up with a national center. And so we had support from the national center that is wanting to push this at a federal level. So they were finding any of our news articles and all of that and trying to push that. They also did a release of this is what we were doing, and we would be the first state in the US to pass this. And they have a PR team in Phoenix, Arizona. And that PR team started releasing it and pushing it out. I will say, once they heard what we were doing and I met with them, it wasn't like that was it. Like, they were texting me, are you at the Capitol today? Like, what's going on today? We've heard that this is happening. Are you aware of this? Like, are you here? Can we meet with you? And so I think too, like, they were just interested, because it's a big deal in the fact that, yes, we're the first state, but I think what most people don't understand is we're looking to push this at a federal level as well, because there are 40 homes trying to open throughout the US, and it's all tied up with legislature.
other people have questions?
Fran
It's
has
like-
his hand up. Go ahead, Fran.
And
I just want, it sounds like you had to invest a lot of time and energy in all of this. It's amazing, congratulations. But did you manage to, I don't know how much time lapsed from the time that you began to the time that you achieved this? Was it one legislative session? So many times you have to go through multiple, sessions.
I started sending out emails to legislators mid-January, and it was on the governor's desk and signed in May. So we had great support. And I think too, like I said, it was very both sides of the aisle. Once they realized what Iowa was lacking and the cause and the need and everything, and to know too that we weren't trying to do anything, that wasn't already basically being done. Just wording it so we could basically exist, I would say, is part of, I think that they realized that we weren't offering things that other states were. And so they were ready to jump on board. And I know too, I was told by the state medical director as well, that he very much thought that this was something that was great, and it's for kids, you know, and so our governor was all about kids, I think, for the most part. And so that was one thing that he had said in the very beginning, because I met with him before I had done any legislators. I wanted to know that I would have the state behind me if we were really pushing this, and that I could have support when I needed it, which really did work out well when I had to prove, you know, our cost efficiency. And so being able to have that support too very much helped, in the fact of knowing that I had their, or in the fact of knowing that I had their support, helped push it through, because I could say, hey, I've already met with this person. I've already met with this person's on board, this person's on board. And when you're talking about a lot of the, you know, state leaders, that really helped us get it through, I think, in one session. And even more so, to answer that too, Fran, is not only did they want to push it through last session, they also said, you know, if there's anything that we need to go back and fix, we'll do it next session, but let's get this through this session. And so they were all working hard. I mean, this went to the House, the Senate changed it, it had to go back to the House, and we were up against every deadline that there is in legislature. We were up against every date deadline, and I'm talking like barely made it on a couple of them by the skin of our teeth. I'm like, I don't even know how that happened. But yeah, just having the support of the state behind you too is good.
The other thing I would just ask is, you seem to have been the main sort of ambassador to this whole thing. How did you keep everyone on the same page with the talking points that were most valuable to legislators to hear and to address, and what not to go into, you know, stay out of the weeds of this or whatever? Having good teamwork with, you certainly couldn't have been the only person who was the spokesman, you know, with every legislator. And
Fran,
so
I was.
yeah, that's what I thought I
I'm
was
like,
hearing.
yeah,
That's what I
I
thought I was
was.
hearing.
Yep.
That's amazing.
And so, and that was another thing that I just literally was like, I'm not going to be able to do this session, you know, and really why I was just like, I'm just going to send an email and see where it goes. No expectation, because, and at that point too, I really started even reaching out, like I said, to friends that knew legislators or had worked with legislators in the past. And I'm like, okay, who can start emailing? Like, I'll even write a template. Can we just start emailing everybody? And so I think at one point, we have a member on our board for Mason's Lighthouse, and she is, I wouldn't say involved with legislature at all, but she knows how it works, and she's done a lot of different things with different groups. And so she's like, I've got about 81 contacts that could potentially be a champion for this. And so I'm like, send the template to them, see if they will, you know, just email it to their local, or I'm like, or this is on Health and Human Services committees. Can you email it to these people specifically? Even if you bypass every other one of them, this is Health and Human Services Committee. This is what we've got to get it through. Start emailing them. And that helped as well. But as for like going to the Capitol and having the conversations that needed to be had with representatives and senators, that it was me. And like I said, it wasn't easy. Senators were not, they had a different mission and a different agenda this session. And so we kind of threw a wrench in their system to have to meet with and go over this, which is why Kara Warmy was the only one that met with me, because she's like, hey, this is important. We're getting lots of traction from everybody on figuring this out, and nobody else is wanting to do this. And so she's like, I'm going to do everything that I can to help you. And it may not be enough this session, but she's like, I'm going to try. So give me all the information that you can. And the one pager wasn't enough for them. On the House side, that's all they wanted was the one pager. And so, like the little 1-page handout that I had. And so I think that was when we sent in the video too. And I'm like, okay, just watch a 3-minute video. And so I'm like, you don't even have to turn the sound up if you don't want to, because it says it all, And so, and I think a lot of them were actually watching it during one of the legislative sessions that they had as they're sitting at their little, desks, but because you can see down there from the balcony what they're doing. And so you can see some of them are watching it on their computers. But at the same time, that really helped put into perspective what we were trying to do.
Thank you.
Shanna, there's a question in the chat, and I'll try and summarize it for you, but I also want to give you a chance to talk about Mason's Lighthouse and where you are with things. But before you do that, if you could answer, Garrett asked, well, first he said, thank you for everything you did and have done. And then he just wants some clarification on why is it important to have a home? You're calling it a home. I think I said a center like this before, but why is it important for there to be homes like this rather than doing the same kind of care in your own home? And then how did that drive you to want to start Mason's Lighthouse? And where are you with things? Because we want to be able to support you in your work.
Yeah. So Garrett, what really drove that was we tried in-home care and we could not get pain under control. Okay. So we're sitting there watching our kids suffer through pain daily and hours of pain. We had tried to go to a adult hospice facility, and we were told only one parent could stay overnight. We would have to pay for that parent to stay overnight, like a hotel fee, basically. And then as for family, we could only have two people in there at a time with him. That's not really ideal for a family with kids, because as you're going through this, you're definitely at the point of you don't want anybody away from you. You're losing one kid and you want all, your other kids close too. Not to mention, I know not all family dynamics are like this, but my kids are super close. And Mason, one of his biggest things was he wanted everybody with him. We had a 1-year-old and then an 8th grader at the time. And so just to having everybody there was super important. We did, in the interim of finding Crescent Cove, we did have to go to the hospital in Minnesota where his specialist team was. And during that stay, only Curtis and I could stay. And so siblings couldn't even come in. And so we really went through, basically the whole aspect of anything that was offered, right? And then when we went to Crescent Cove, he was just a different kid. He lit up. It was like he kind of rallied for a few days and he got everybody with him, that he wanted and was just okay with everything at that point. And I think from that experience and knowing from the very beginning that we were leaving all of our big support system at home in Iowa and traveling about 5 hours to Crescent Cove, that we were at the point of, are we even making the right decision, right? So we walk in and Mason's face lit up and he's like, this is like a hospital hotel. And so he was just so happy to be there and just being able to see the difference from that. You think a lot of people, know adult hospice, right? It's you pretty much stay in your room and kind of everybody's quiet. And I mean, you may hear some, machines beeping here and there, but at the same time, like it's pretty quiet and kind of, I would say more like people are more down in the dumps and they're just kind of at a children's hospice. These kids are playing. They're hooting and hollering when they can. You've got respite kids there, that are not there for hospice and they're bringing life to this home and they're loving it. And in fact, we got to see a couple of the kids basically push their parents out and they were nonverbal kids and they were in, in their wheelchairs, and they're basically pushing their parents out. Like, this is my time. And you could just hear them laughing and playing. And, all the rooms are basically common areas. If you're in the music room or if you're in the toy room, craft room, whatever, you're doing all these things alongside other kids too. And I think that's special as well, is being able to be with other families and not feeling so isolated and alone as well. And these kids Mason really enjoyed being there with the other kids. And in fact, that is the one thing that he said before he passes. He wished every kid could have a home like Crescent Cove to go to. So with that being said, we have land. We lost it. We have land again. So we are getting ready to announce that at our big gala here in November. But we are going to be building in Iowa City on the old ACT ground. You guys are familiar with the old ACT campus. And so we're going to be building over there. We will have 3 hospice patient rooms that will be connected to family suites. And then we will have 4 respite care rooms. Within our legislature, we had it passed so we can basically use those rooms for any of what we serve. In case like there's 5 respite kids, we can use a hospice room or whatnot, but very versatile in that aspect. We will also have like a hydrotherapy room for respite kids stays. I mean, hospice could use it, but mostly will be for respite kids. And then there'll be like sensory rooms and a sanctuary, a peaceful place to be, and just some different options to support these families through their whole journey, not just through end of life, but once they're diagnosed, they can start coming and using us for respite. Whether it be the whole family stays and they just get a break of, caring for their kiddo that they're caring for 24 hours a day, or whether it's they have to go on a work trip or they've got other kids doing activities that it's just not quite as easy to take the special needs child to. So being able to offer those kinds of things, it won't be, some people will be like, oh, so it's like child serve. It is. But like Dr. Terry says too, it's completely different because we're not offering that daycare type service either. We're offering, this is like your 20 or your 48-hour stay through like 7 days. And so it is still different. And then end of life wise, we will have those kids from whenever they're diagnosed as a hospice patient and want to come in. And again, not every patient is going to use us by any means, but we want to have that availability. And, what we call our red patients, our highest need patients, a lot of those will still be in the hospital because they just can't be in home. But our home is basically an extended type of a home situation. Anything that those parents are doing at home, that's what our nurses and staff are doing.
Thank you
Thank
so
you.
much.
Yep.
Yeah, you were getting lots of thumbs up and hearts from Garrett through your talk there. So, and lots of love from the rest of us too. Thank you very much for sharing your story and all those details and what you're working on, and just hearing your story again there at the end and about Mason and his reaction. It's like, how can anybody not support this?
Yep.
So I know it was a lot of work, but it makes you wonder. Well, just and to hear you say what it takes to really have them understand what you're working on and why it's important. So thank you again. Any other questions for Shanna? Okay, well, if you do have questions for her or for us, we can come back to that. You can send them in to us also. Shanna, you don't have to stay on for the rest of our talk today unless you would like to.
Nope, I'll leave you to it, but thank you guys for having me.
Thank you again so much. We really appreciate it.
Yep. Have a great weekend.
too. So now you see why we had to have her on. She's just awesome and it gave such a good example of what it takes to get a law passed and to change policy. And what we are going to talk about a little bit more today, and we do have a list of tips that are part of what Shanna talked about today, but kind of quickly here, we'll go through maybe some ideas for you all. But these are ideas and feedback that we got from the attendees at our Make Your Mark conference last week. If you weren't there, we played kind of a game at lunch where we had everybody answer questions and have it be around policy and talk about what they would like to see changed in Iowa, and help us maybe guide some of our discussions around these issues too. So one of the questions was, if there's one thing you could change about Medicaid, what would it be? And we had 19 tables of people talking about these questions. So we got a lot of feedback. So you'll see a lot of bullet points here. I'm not going to read through all of them, but having healthcare for everyone or anybody that needs it, anyone who needs it, was the most important. So the common theme was about access, making sure there is access and improving access that we have now, so that people who need Medicaid can get it and can keep it. And that's not even getting into the coverage and waivers. That was just the basics of Medicaid. So in addition, you can see here, it goes into some of the limitations that there are with Medicaid, getting rid of wait lists for one thing, penalties for too much income, penalties for being married, lots of things we talk about under kind of the work without worry bill that was our big emphasis last year, but also mental health services and better ways to navigate the system. So work and eliminating assets and income limits were kind of the other big common theme that came through. And you'll see here with some of our other questions, and you can move on to the next one, Amy. And I was at one table too, going through these questions with everyone, and I swear every question that we pulled up, Medicaid became part of the discussion and part of the problem solution arena that we needed to work on. And so did the issues and the concepts that are under the Work Without Worry bill kept coming up a lot. So what's one change that could make Iowa more inclusive? The common theme here was basically better supports in the community, and that has to do with tangible things like transportation, housing, again, Medicaid, but then, some other maybe more intangible things like just recognizing that disability is something that needs to be included, not excluded. Empathy, and that there is, a lack of empathy in the way our policies may be getting put through these days. So, and just basic accessibility, physical accessibility of our communities for people who need to navigate in different ways. And I noticed special education was on that one too. The question number 3 was, what's the biggest barrier to achieving your life goals? Well, not everything that was on this list may have to do with policy, but a lot of it was. So a big theme again was, how can we make our state be more inclusive in the policy arena, and how we look at things like employment, and just the basic supports that are in place now but are not enough. we're forcing people to live in poverty if they're on Medicaid. Or as you can see with what's going on at the federal level, we're going to be potentially taking away coverage for millions of Americans, thousands of Iowans, if what was passed this summer is implemented in full, and what may be coming with the next appropriations under federal appropriations. More people could be losing healthcare coverage. So, and we know this from our survey that the DD Council did earlier this year, that healthcare was a huge, was the top topic for how everyone's, the top solution for how everyone's life could be better. So, jumping through hoops for services and then facing limitations when you do get the services is the big overriding issue that came out here. In addition to not having the care and the caretakers, the direct support professionals, and that would be in numbers and how they are supported too. What disability-related topic do you think would be important in Iowa in the next 5 years? This kind of comes up with our overriding question, which is what would everybody like to see passed? But again, like work was kind of the number one, and we know that work and employment and the workforce in Iowa are big topics for everyone, both parties. The way that we get at those issues, though, and the way we're come at them may be a little bit different. So there were some people here that talked about job coaching needing to be expanded. Also, again, limitations on work when you're on Medicaid, reimbursements for Medicaid reimbursements to providers. And there's been a lot of some policy changes lately with CDAC and some home and community-based services that are being changed. And that came up in addition to, things like abuse and neglect in institutions and making sure that, just making sure that people are listening. And that's where you all come in using your voice. And so we also asked people if they have their story ready. If you want to make a change, are you ready to tell your story like Shanna did with her family and her son Mason? And she became an expert at it very quickly and was successful because of her commitment and her passion to get this through. And it takes a lot more than that, as she said, but it really takes that story and making an impact as you tell it to legislators and doing it in several different ways, like the video that she talked about. She said that was really a game changer for them in the Senate. So we will continue to talk about ways that you can tell your story. We might have to do a Capitol chat on how to make a good video, Amy. That might be next. But our one big question was, what's the new law or policy that would improve the lives of Iowans with disabilities? And we had a lot, again, talk about Medicaid. Work Without Worry came up a lot. Increasing reimbursement rates, funding. There's always a lot of more. We always need more of this, more of that, more money, more empathy, more, yeah. And we had legislators there at the lunch who were kind of judging, what is good on using the criteria of, is it practical? Could it pass in the next year or with the current leadership that's in place? And one thing, that comes across, and we all know this, is it can't cost a lot of money. So one thing that they honed in on that was something kind of simple, it's not going to be simple to pass, but simple in concept, is, you'll see in the highlights there, exempting people with accessible parking permits from having to pay for parking. it's kind of a novel idea. It's innovative. It would save people money, maybe help more people get to work if they could park closer, or, for goodness sake, this passed in Texas. If it can pass there, perhaps it could pass here. So that was what was voted kind of the one that had the most potential. Another was to give businesses who hire people with disability priority in receiving state funds for other things, including affordable housing, um, and using some trust funds for this. So this topic has come up a lot as far as business incentives for businesses for hiring people with disabilities. And so that's one too that we'll take to heart and start thinking about ways that that might become part of our priorities also. So kind of back to, if you're ready to work on this, what can you do? And thinking about Shanna's tips here. So work with your policymakers, right? You have to know who they are. If your idea is, for example, eliminating parking fees, that might be something very local. You might just need to go to your city council, but it could be state law also. Maybe not federal at this time. There was just a lot of other things going on at the federal level that they're going to be working on. So know which policymakers you need to contact and who will work on what. And if you're not sure on that, we can help you work through those things. But getting to know them, before you also want to ask them for something is a good thing also. So getting to know who your policymakers are now is always important. You're going to tell your story, right? Describe the problem, come up with solutions. As Shanna told us so eloquently, back up your story with data and know what's going on in the current law. Know what's in current law, know what's going on in other states, so you can share examples of maybe what's worked or what's in place in other states. But having that data available is very important. And as she said, the Senate in Iowa was, very tuned into the data. The House was a little more tuned into her story and why this was important for families like hers. So offering solutions, Shanna had looked at Iowa law, so she knew what the solution would be for this kind of center or home that they thought would be so important for other Iowans. And then think about number 5 here. How does this align with the values of your policymakers? As Shanna said, in the Senate, it had to be something that didn't cost the state money. And if it saved money, even better. That's the value that those senators were working under. So she had to express their need through those values. And and number 6, she did this all on her own, but having a movement behind you can make it a lot easier. And building that movement is important for a lot of reasons, to get organizations behind you too. And then this has happened in her case where there's now a national organization working on this. So they are building a movement. She was just ahead of the game. And then our, common tips are to be personal, polite, patient, prepared, and as she was, persistent, and don't give up. So that's our tips of the day, and I'm going to send it over to Amy for reminders of what else is going on in politics.
Yep. Well, we have about 5 minutes left, so I want to this is just a reminder to everybody that we do have elections coming up in November 4th, and I know it feels like it's early, but you can start requesting your mail-in ballots now. We talked a lot about this last Capitol Chat. And so if you missed that, you can go to our website and watch the video. The Secretary of State's office has a ton of information available there. But I think really importantly, especially if you think maybe you've moved since you last changed your voter registration, to just double check that it's current. and that you are registered to vote, because that can take a little bit of extra time to do. You can see that the voter registration deadline, it's called a pre-registration deadline, is coming up here in a few weeks, October 20th. So just a reminder, city and school board elections are really important. When you're talking about parking fees, it's the cities that are usually setting those parking fees and deciding where there will be parking meters and who will have to pay. And so having people on those city and school boards to help with your issues is really important too. I think we all learned about school board elections over the last few years, where there were battles there over books. And now we have special education issues. So these are the people that are making policies for your local communities as well as your local schools. So just wanted to give you guys a reminder of that coming up. Just quickly before I turn it over to Brooke and Carlin for talking about next month, but we have 2 more capital chats so that this year we try to give people space during the holiday season. So they are coming up on October 31st and 5th. Our legislature is back in session on January 12th. And we'll be returning at that time to the every other week Friday shorter capital chats, the half-hour ones. I think if you do have ideas on getting bills requested, contact your legislators now. They can file bills now. They can request them now. They won't be introduced until session starts, but they only have 2 weeks to request bills this year. So they'll have to have any bills they want to have drafted, requested. You don't have to have the bill in hand. They just have to have requested it by January 23rd. So those of you that may have ideas or know people that have ideas, encourage them to get those ideas to their legislators between now and the end of the year, I would suggest. You still have time when session gets back in. Also, we do want to know what topics you want to have covered in our next couple of meetings. So if you want to throw those into the chat, I know we don't have much time to talk about it, or email us. If you have ideas of what you'd like us to cover during those, please do so. And Brooke, do you want to wrap us up with the what's coming up next week with National Disability Employment Awareness Month?
Sure. Thanks, Amy. Yeah, so we are doing a Workday with Your Legislator campaign again this year. So if you are an advocate and would like to show off your employer and what you do for your job and talk a little bit about how employment's important to you, and also maybe share why, some things are difficult for you, like making more money or taking a raise and being able to keep your benefits. And this is a prime opportunity to do that. So our website is there. And also, if you are on and you actually employ people with disabilities, or you know of a business that does a really good job of employing people with disabilities and they want to participate and showcase their company and the employees they hire, they can participate as well. So it doesn't have to be a self-advocate that signs up. An employer can sign up as well too. So do check that out. We've had a few people that have done it yet this year. So we can do it throughout October, and you really can invite your legislator to come at any time. It doesn't have to be during October, but we just highlight that because it is National Disability Employment Awareness Month. So check that out. I do want to just mention, we have like 1 minute left. We will be doing our annual survey that comes out also right around this time, and this is a way that we get feedback on what the council's doing, how we could do better to help you guys be better advocates. So when you do get that survey, please do fill it out. It's very important for us to keep doing these types of activities and make them even better. And I think that's probably all I have to share. Oh, and join us for the October 31st. I'm just going to add here, if you want to wear a costume virtually on Halloween, please do so. And us staff should kind of think about our theme that we want to do that day too. You could do a theme about that. So yeah, wear a costume on the 31st Halloween Capital Chat.
Is that a virtual costume? Like it's not really there, but
Well, you can do all those fun things now with Zoom. You know, you can make your costume on with Zoom probably, or you can wear one.
There you go.
Thanks, everybody.
Thanks for joining us today, everybody.
Bye.